So a lot of doctors would ask me what my setup looks like in my office, and I have 4 different treatment rooms for the lasers. I have one that's dedicated to the Erchonia. You'll see these videos coming up. I have one that has my old FX in there and also some stands to put handhelds in there. I've got this one which I've made my dedicated laser plus BrainTap room, and then my other room that has my new FX405 and where I utilize a lot of my neural recalibration protocols and other types of treatment protocols we're doing. But I wanted to show you this one because it's very easy to do to help patients with brain support. Now, if you want to enhance this is where we utilize the BrainTap device that you see over here. But even if you're brand new to laser, you can just create a room like this and stick a patient in there with a laser, get it on their head, and that's going to do some great things for their brain. So whether you have a diplomate in functional neurology or you're just getting your feet wet into doing different types of brain protocols, this is very simple. As long as you get that laser on the brain, you're going to make some improvements. You're going to stimulate brain-derived neurotrophic factor. You're going to decrease inflammation. You're going to support lymphatic drainage. You're going to support also the formation of new blood vessels on here. And you can try to impact their focus, their concentration. And if you pulse this at 40 hertz, the studies have been able to show that you can help to break apart amyloid beta and tau protein malformations in the brain. So here's one of the things that we'll do is we'll take the patients and we'll utilize the BrainTap device. And what's cool about this is it's not very expensive for you to get in your office. It has a great setup like this where you can have different preset protocols here. As you can see, one of the things I'm going to utilize is this concussion recovery protocol. So we can tap on that right here, and it's going to bring up different protocols then that we can just press start, and we'll have the patient lie down on the table while we have the BrainTap device on here. And it's as simple as this. You put the laser here, you put the BrainTap device on. This is going to go over the eyes. So what's going to happen is you're going to get different pulse frequencies of sound and also of light here to create brainwave entrainment. Now this is based off of research that goes back to actually the CIA in the 1970s, Stanford University and the Monroe Institute when they were creating the Gateway Project for the CIA's psychic spying program. If you want to see more details on that, go to cia.gov and search under Gateway Project, and you can see their findings, which were pretty amazing. Now what's really cool about what came out of that is that it's where we learned that we can get the brain waves to oscillate in basically a synchronized right and left hemisphere with this hemisync type of a technology on here. And then we stack the laser on top of it, you're going to enhance it even more. So here's what it looks like. I'm going to bring this a little closer over here to the table, and I'm going to use my GVL. I like to combine all the wavelengths whenever possible. So a lot of times I'd use the FX as well, but here I'm going to use the GVL, and I've preset this to have a few different settings here for the brain. We got some ADHD settings, some basic brain like Dr. Barry's settings here. You can see that they're brain protein, also delta if we want to get someone to a delta frequency, if we want to get them into an alpha. Or for focus, I'll use a combination of 10 and 40 or 40 and 60. So there's a lot of different options that you can use. But we'll just take this, we'll pop it into the stand right here, put on whichever brain setting I want to do. And again, 40 hertz is going to be great for breaking apart amyloid beta and tau protein malformations. So we'll have the patient lay down right here. We'll put the BrainTap device on, and then you have the start at the same time here. So I'll just, as a demo, we'll start this up. And here's where you can see on here that this is going to flash with some different frequencies. These are LEDs here, so the eyes will be closed as you're doing it. And then here you've got also light and sound coming out of here. So we're just gonna pop on like this. There's a guided meditation in here, or there's just music. The patient can control their volume and also the intensity of the light right here. So in case if they're too sensitive to light or sound, they can calm it down. And so here, we're gonna lay back here, and I'll get the laser at the top right here. And so I've got the laser there on the brain, just like this. And the patient can simply lie here for a 10-minute protocol, 20-minute, or 30-minute protocol. Alternatively, we can also take the laser and apply it over the carotid arteries here. That's something that the Russians have been doing for a very long time, and it's unique to utilizing these high energy wavelengths, is that we can apply it over the carotid arteries. It's going to get picked up by the bloodstream and then delivered to the areas that you're activating. So as this is flashing and as this is also playing the sound and you're activating those different pathways, you're going to get those neuronal pools to fire. Blood flow is going to get to that area. We had the laser over the carotid arteries. It's going to get picked up from here and then delivered to your targeted tissues wherever you're activating it. So you can go here or you can go over this area at the same time. Another way to enhance this too is I also like to have an essential oil diffuser going on in the room because then you're going to stimulate the olfactory bulb. You're going to stimulate the sense of smell, which that has a bunch of impacts in the brain, stimulating the hippocampus and whatnot. So those are really easy ways you can do a brain-based type of a treatment with your patient to get great results. Also, it doesn't take a ton of your time and it doesn't have a big steep learning curve. You can literally get your lasers and do this on day one. If you're interested in the BrainTap device, I got mine from Sean Bean. Sean Bean is great. She used to be a rep for Erchonia, so I've known her for years and I worked with her when we were doing seminars, and now I got my device from her. So if you're interested in that, be sure you contact her. If you need her contact information, just send me a DM or mention that in the comments and we'll get that hooked up for you.